consider themselves to be on the left to propose something different. Now, the general standard thing in healthcare is that the right wing supports big healthcare corporations. I think we should be clear about the language on this, because language is very important. This is not private insurance or private companies. These are some of the biggest corporations in the country. Blue Cross, United Healthcare, Aetna, and so on and so on. These are giant firms. There's nothing private really about them. They're creatures of Wall Street, and they're almost entirely owned by the same people who own millions of shares of stock. So it's not a question of having private insurance or having government insurance. It's either having government or big corporations handle the insurance and the costs and so forth. Single payer health care is where the government does everything in terms of handling the reimbursement and the insurance for health plans. And this is a plan that many countries have. Canada is a prime example, and there's others. France has a kind of modified version of this also. Then this is not a left program. Single payer is not left. What is left is, on the left, is what's been called in a derogatory manner socialized medicine. And socialized medicine, or public health care, probably more accurate, is something where the doctors and the hospitals are run and owned, and the employer is the government. So England has this kind of system where all the doctors work for the government. And if you saw Michael Moore's Sickle, he interviews a doctor in England about, how does it feel to only make $80-some thousand a year, when U.S. doctors, not all of them, but some of them, are very, very wealthy. And this particular doctor in England said he felt fine, he could do everything he wanted to do on his salary. And then public hospitals are, what used to be in England private hospitals, like St. Mary's in London was a Catholic hospital. I think now it's a public hospital. And the same would be true here if we had public health care. The nursing homes would be public entities. And I have to say, from having a friend who's temporarily in a nursing home, that the condition of the nursing homes in this country are a disgrace. They're understaffed. They're places they're warehouses for people. And most of them have multiple citations from state inspectors about deficiencies in the care of many people who are unable to stand up for their own rights. And this would not be the case if we had a good public health care system where there were levels of funding for all these institutions that would ensure that they would not be in the same shape they're in now. The reason nursing homes and many hospitals are substandard is because they're owned by either corporations or they're owned by doctors groups that are mainly interested in extracting profit. And so they not only do they understaff them, but they find other ways of reducing their costs. The particular nursing home that I visited last week is interesting because all the healthcare workers are Filipino and all the doctors are Russian. Now, why is this the case? Well, because in general they can get them to work, as immigrants, they can get them to work for lower pay, and very few nursing homes, particularly in Southern California, are unionized, so they can work for lower pay. And one of the other things that this practice does, and is a general practice in the healthcare industry, is it depopulates third world countries of skilled professionals. So I've talked to friends who visit the Philippines regularly who are Filipino, and they say that they have a crisis there because they don't have enough healthcare staff. There's a lot. They get trained there and they immigrate to the U.S. where they're welcomed here because of they have a skill, so they can gain immigration rights. And this is, the Philippines is one example, but many countries are, suffering in this way, and I'm sure in Russia now it's much more profitable for a doctor to come here than to stay in Russia and treat people in an economy that's been devastated ever since the fall of the Soviet Union. I'm going to try to cut this off as quick as I can. The whole struggle for decency in healthcare, where people's needs are placed over corporate profit, is a struggle that we on the left are concerned about. Not just healthcare, but housing and transportation and every facet of life. The guiding principle, and this is what socialism really is, the guiding principle is that people's needs take precedence over individual or corporate profit. So it's going to be a long struggle. Even if there's a bill, the Baucus bill or some other bill that comes out of Congress and is enacted into law, that's not the end of the story. It's a bonanza for the big corporations, but it's not going to solve the healthcare problems in this country. And the struggle will continue for single-payer healthcare, and I believe ultimately a public health system where doctors work for the government and not just doctors but medical personnel as a whole, and hospitals are run by the state. But I think for us on the left, we should not be distracted by this whole discussion and debate about, well, we had a little bit more in the Baucus bill, maybe it'd be okay. It's not okay. It's all a giveaway to the corporations. And what we have to do is keep our eye on the ball, and the ball is, in this case, single-payer health care. And we should continually advocate that as a solution for the reimbursement question. And then the other issues are not going to even be solved by single payer, but they're going to be solved later on by public health, which I think we should also be talking about. What would a good healthcare system look like right now? And I just want to pass out, in 2007, I and other people in this room worked on an initiative petition for California for single payer, and I think this we didn't get enough signatures because once again the Democrats would not back this bill. They were fixated on a bill in the state legislature that had no chance whatsoever of getting signed by